30 minutes or so on the practical aspects of Teach to Reach. So especially for those of you who are here for the first time, we have another 30 minutes to go before the formal opening ceremony. And you should be by now in Hopin. And so I'm going to take you through the process. If you're not there yet, I'm going to show you step by step what you need to do to actually get there. So we'll be starting from scratch here, but you should be here. And you can see here there's Melise Teferi who says hello. So he's calling in from Addis Abeba, Ethiopia. Abeba Sorsa also from Ethiopia, MOH. Hawa Buhari from Sokoto State, and Dwayuto Azugo from Nigeria. And as you can see, there are many more people joining via social media, as well as our speakers who are in the Zoom studio and movements, IA 2030 movement leaders and others. So now I'm going to show you the practical steps to actually register for Teach to Reach Connect. And Charlotte, what would you like to say? Do you have a word of encouragement for people who are joining Teach to Reach for the first time and who've struggled, who couldn't figure out what is Hopin, how do you register, what is a ticket? Is there anything that you can say to reassure and encourage them?
First and foremost, Fred, I want to say a warm welcome to all those who are joining us for the very first time. And then secondly, I want to say you are joining the biggest experience sharing event that among health professionals that you could ever join. And you have two possibilities for experience sharing. We have the plenary sessions here in Zoom, where you listen to experience of others, but there's the special experience sharing that takes place in Hopin on a one-to-one basis. So what I'd like to tell you is follow keenly to every step that Reda is showing you if you have not yet got to your ticket or registered to Hopin. It's simple, it's straightforward. If you're having connectivity challenges, I advise you, maybe you may have to make a choice. Either you listen to the group experience sharing here in Zoom, or you go to Hopin and then you can juggle between the stage and the networking. That way you listen to the plenaries on the stage in Hopin, and then you can benefit from the networking with peers that are also there. Thank you, Reda.
All right, great. So what is Teach to Reach about? First thing is, here you can see how a participant of the very first Teach to Reach Connect summed it up. So he said peer learning is the key to success, and networking is the key to peer learning. Now, we've seen over successive editions, this is the 6th quarterly Teach to Reach, and Teach to Reach Connect 4 already had 6,163 people registered, including 3,445 Anglophones, as you can see here. Teach to Reach 5 had 8,584 health professionals, immunization professionals registered. And I'll let you guess, imagine how many have joined Teach to Reach Connect 6. And this was the number this morning, 12,398 health professionals. And for the very first time, Teach to Reach has opened up to health professionals working outside of immunization, as I'll be explaining in a minute. Now, for the networking, for the entire event, check your inbox, take the time to read the emails. You'll find a discussion guide that covers all of the sessions that are happening today. Each edition has really 2 tracks. On the one hand, you have plenaries and concurrent sessions. So that's what we're in now. Right now is a plenary. If you're in the Zoom studio, but you could also be on the stage in Hopin, or you could also be watching on YouTube or Facebook or Twitter. We want to meet you where you are. So we do not force you to register, sign up for a platform. Now, that is for the plenaries. Then you have the networking. And that can only happen in one place because of a special technology that's needed to support it. And that is in the Hopin platform. So if you haven't done so yet, well, I encourage you to go look at the link I'm sharing now. And I'm going to show you the practical steps to actually join in this Hopin, so you can participate in the networking and get the full benefit of the of Teach to Reach. Now you can see the full schedule here, so let's actually go there and have a look. So as you can see here, if I scroll down here, I have the schedule right here. And if I click on schedule, then this scrolls down. For those of you who couldn't figure out how to get the English language, right now there's only English language sessions left. I think there's a couple that were not. Okay, actually, right here, it's once you register that you can see the live information. So here we've just finished the slideshow, as you know. Whoops, I'm trying to scroll a little bit, but it seems I can't. So you can see this is in English. Now, second is right now, this is the session we're in now. And then you can see the following sessions. But in order to see what is live, what is happening right now, you do need to register. So I'm going to show you that process. It starts by clicking on the register button. Now, some of you have gotten sort of these bizarre errors trying to sign in. And it's usually because, one, you already have a Teach to Reach account, in which case you need to use the little sign-in link. If you already have a Hopin account, so that means you participated in Teach to Reach before, you need to sign in to register automatically. Now, before you click on sign in, you do need to choose the ticket that you're going to use. All the tickets are free for country-based health professionals. And so here you can see this is for English speakers. Don't accidentally click on Français or only click on bilingual if you actually speak both English and French. Otherwise, you're going to find yourself in networking meetings with people who speak a foreign language that you may not master. So what you want is click on English. All right, you can see it's lit up in blue. And then I'm going to click on continue. And here I'm going to click here. I'm going to put in my email. Oops, okay. And guess what? I get this funny message. You can't assign a ticket to this email. Now, this is completely cryptic, but this is because I already have a ticket. So what I'm going to have to do is actually sign in. But for the purpose of this demonstration, I really want to speak to the participants who've never participated in Teach to Reach before. So I'm going to add a little tag here that will get Hopin to think this is a different email. I'm going to register here, and then you'll see that's it. I'm done. I've registered. I'm going to Teach to Reach Connect. You can see the time here. And then here's the key. You don't need a password or anything like that. The email is sent directly to you. And I'm going to show you this email in a second. Charlotte, any questions, anything you'd like to share on this registration process? It is not the simplest process in the world, but it does work when you come down to it. What's been your experience? What tips can you share with our colleagues?
Really, I think you have said everything, Reda, but it's really important to find that email because it's like the key that gives you access into the event. And it's almost immediately, as soon as you register, you get the email that is asking you to join the event. So if you have not yet been able to access and you already clicked on register, maybe you were following as Reda was doing so, go to your inbox now and find the email with the subject, "Thank you for registering to Teach to Reach Connect 6." Once you get that, there is a blue link. You click on it, and then you are in. Reda, comments in the chat are still about the photo stories. Some people, They really want to share their own photos now. But I think the opportunity is we have the Telegram channel where you have the opportunity to continue sharing your pictures.
And the other thing people can do is if you use social media, so if you're whatever it is, Twitter, Instagram, just tag the Geneva Learning Foundation and we will reshare it as an IA 2030 movement photo. If you're a member of the movement, that you can include your story with it and they will go out that way. The stories we've selected are those where people gave us the specific, we asked for specific permissions. We asked to make sure that every person in the picture that you've secured their consent to share their picture and so on. So that is why we cannot simply collect sort of random pictures, but we can reshare and like the photos, and we'll certainly do so. Now, to the task at hand, we want to find that email. So the email says, "Thank you for registering for Teach to Reach Connect 6." And then you scroll down and you see Enter Event. And that's it. It doesn't even ask you for a password. You don't need to really create an account. All you need is this email that is different from what's shown in the tutorials, in some of the older tutorials, because Hopin has upgraded. So that is how you can actually make it through to Teach to Reach. Now I am in. So as you can see, it's quite different. You have the stage that is live. So let's go have a look there. And guess what? This is where you can actually watch the plenary. Now, if you're watching on YouTube, Facebook, Twitter, or in our Zoom studio, this is actually a better place to go. You can see that Samuel Maloga has left a nice message. Hello, Samuel. Subarna Sinha Mahapatra from West Bengal has also left a message here. And you can share messages. There's more. You can look at our Twitter feed where we've got some members of the TGLF team who are sharing what is happening in the conference that is on the stage. And then you've also got the event chat. Okay, so here we have some Francophones that are still talking. You'll see, I'll show you the other areas, but the most important thing, so you know where to go, where you want to go, is to go look at the reception. So what's in the reception? Here you have a description and then you have the schedule. But here you can always find this black rectangle says stage is live now. And this will change as different things are go live. Right now, if we go to the stage, you can watch this plenary. So you may already be there. If you're there, that's fine. You see go to stage. But here is, you see now the schedule is live as well. It shows you what is happening now. And this is important because after the opening ceremony, there will be 2 or 3 sessions running parallel at the same time. So this is just like in a physical conference, you will have different rooms. And so you're going to have to make decisions about which room you want to go to. But right now, this tutorial is the only thing that is running. Now, the next session, you can see starting at 2:30 p.m. Geneva. If the clock on your computer is set correctly, you should be able to see your local time when you view the schedule. So you may see a time that's very different from what I see, which is the time in Geneva. And here you have the opening ceremony. And now here's what's kind of neat. If I'm interested in this session, I want to make sure I don't miss it, I can add it to my agenda. And here you can see that over on the right-hand side, you have something called My Agenda. And I've just added the opening ceremony now. And I can do this, I can go. So I encourage you to go now to Hopin, get your ticket, because otherwise you're going to miss a very big part of the conference experience. Choose, for example, I know that many of you are most interested in the session on building confidence in COVID-19 vaccines. So I'll add it to my agenda as well. Networking. 1, how I overcame my challenges to improve healthcare in my community. That's for the IA 2030 movement members. Now, these 2 sessions take place at the same time. So you have 2 options. You can really make a choice. Say, okay, I'm going to the plenary. I'm not going to the networking. Or you can move back and forth. Many participants sort of stay in Zoom, keep an ear in Zoom on one device. You can do that on your phone. And then on their laptop, they go for the networking. And the networking is really probably the real thing that differentiates Teach to Reach from a lot of other information-focused events, because it is about peer learning in a way that is different from the plenaries. And that's what I'm going to show you next. Charlotte, any questions or specific points you'd like to add before we show networking to the group?
No, rather no comments or particular questions in the chat around this particular segment.
Okay,
so
great.
We can proceed.
All right, so here, now this is new. Even if you've participated in Teach to Reach before, this is completely new. And it's really nice. You're going to see it. Networking is now called People. And so if you want, for those of you who've done Teach to Reach before, used the Hopin platform before, you've got the speed networking here. And that is where you go in. I'm actually going to do it. Maybe there's somebody already. There are probably already people networking. Let's see if we can get someone. You see, I just click on the join button and I'm randomly matched with Dr. Bala Ganesakumar. He's probably going to be surprised to see me. Let's see if he's going to answer. Okay, I'm going to turn off my webcam just because that's very confusing. Dr. Bala, greetings. This is Reda Sadki. I'm actually speaking to you from the plenary, sir. So warm. I'm doing a demonstration of the networking. Can you tell us, has the networking worked for you? Have you been able to network with others so far?
Yeah, thank you. Thank you, Reda. Can you hear me?
Yes, loud and clear.
Yeah, I want to introduce myself. I am Dr. Balaganesh Kumar, working as a surveillance medical officer in India.
All right, honored to meet you. And so if you will allow me to use this session to demonstrate how networking works, I just want to show participants, especially those who are in Teach to Reach for the first time. You can see there's a 5-minute clock here. And so it's a 5-minute timer, but you see as it winds down, you'll have the opportunity to extend the time. So you can actually have quite a long, detailed discussion. Remember, we shared discussion guides on specific themes. So once you've met, once you've sort of chatted socially, you can dig into the topics. And then Dr. Bala seems like someone, fellow professional that I would very much like to keep in touch with. In that case, I click on the connect button. And now this is important. He will have to reciprocate. Both parties in a networking meeting will need to connect. Otherwise, you will not get the contact details for Dr. Bala. So Dr. Bala has to say, yes, I'm interested in staying in touch with Rada Satki in order for it to work. And then in some cases, you will have to try 2 or 3 times because of connectivity issues. And if it doesn't work out, if the meeting doesn't work out for any reason, you can leave. And Dr. Bala, thank you for your helping with this.
Thank you, Reda.
Thank you. And I'm going to leave now. I have asked to make the connection with you. Take care. All right. And so I leave now. And once you finish one meeting, you can go on to the next one. But that's not all. There is something new in this Teach to Reach for the first time. And you can see here that there's an artificial intelligence engine in Hopin that has looked at your profile and that has determined that these individuals, you may be the ones that you're interested in connecting with. So you have some recommended connections and say, for example, okay, so TGLF is recommended to me. I think that's a pretty intelligent AI. I can send a message to TGLF. So I'll go here and use, right? And there you go. And I can also invite TGLF to an instant video call or request a meeting. So these are new available options. Tell us if you're being spammed, if this is not helpful. We will turn these options off, but we wanted to try it for this Teach to Reach, knowing that there are going to be many of you connecting. The speed networking is completely random. The recommended connections, you can actually read through the individual profiles and choose to reach out to someone if you see someone that you particularly like to engage with. So this is a new, a new step in the, in the networking, less random, more focused on helping you connect with the right people as just connecting with individuals to hopefully take a chance on having interesting conversations. Now, that's for the schedule, and that's a quick overview of Teach to Reach, but I'm eager to introduce our partners and the specific sessions and plenaries to give you a good sense of, to help you get a sense of what is going to happen this Teach to Reach. So first of all, very pleased to announce UNICEF as a partner for Teach to Reach ahead of UNICEF's COVID-19 Vaccine Demand Global event, together with these other partners that you see at the top. So the American Centers for Disease Control, a collective service, Gavi, USAID, IFRC, and the World Health Organization. Now, so 5 days after Teach to Reach, this global event will be taking place, and I'm pleased to share that every participant of Teach to Reach who shares their feedback on the topic of COVID-19 vaccine demand will receive an invitation to this global event to actually attend the event. So that is a big announcement. We'll talk about it more during the COVID-19 COVID-19 vaccine demand plenary session, but that is big news. And then second is the second plenary, which is the plenary that will be led by the Women Who Deliver Vaccines Collective. And so this, you will hear stories of overcoming gender barriers, and you will hear Women Who Deliver Vaccines speak in their own names, but they have invited men who deliver vaccines to share their solidarity and share their own experiences in challenging gender barriers. In addition, this plenary is being done in close collaboration with the Zero Dose Community of Practice established by Gavi. So those are two of the major partnerships and sessions in this Teach to Reach. But that is not all, because, as I said, Teach to Reach for the first time is extending beyond the theme of immunization. And we're going to have a major plenary on the neglected needs of women's health, and one specific neglected tropical disease called female genital schistosomiasis. Going to ask Charlotte to sum up what's going to be the purpose and the focus of this session.
Definitely read that. So this particular session, last year with Bridges for Development and Sorry, Reda. I was having connectivity issues, so I was joining on another device. But I just wanted to say last year with British Development at the FAST package, there was this workshop on female genital schistomas that were organized, focusing mainly on Ghana and Madagascar. And so, but we opened the invitations to other countries, and we had over 300 health professionals that joined and took part in this exercise. They developed action plans, took part in an impact accelerator, and they'll be coming today during this plenary session to share their experiences. What have they been doing since the last FGS impact accelerator, since developing an action plan on female genital schistosomiasis? So I would like to encourage you to stay put for that third plenary session. If you have never heard about this neglected tropical disease that affects about 56 million women in sub-Saharan Africa, please join us for this plenary session. Thank you, Reda. Over.
Thank you, Charlotte. All right, now we're going to turn to you. If you'd like to raise your hand, I'm going to lower all of the hands that are raised already in our Zoom studio. Feel free to share. So we have 3 networking sessions: how I overcame challenges to improve healthcare in my community, what I am doing to build confidence in COVID-19 vaccination, that's with UNICEF. And then the third session is how I'm challenging gender barriers in healthcare. If you'd like to share, tell us which of these sessions are you most interested in and what are you going to share with your colleagues? Charlotte, who shall we hear from now?
I've just invited Hafsat Yau to unmute. If not, okay, Hafsat Yau, over to you.
Hafsat, please do introduce yourself and tell us when you joined the movement, and then tell us which of the 3 networking sessions are you most interested in?
Yeah. Good morning, good evening, everyone.
Welcome, Hafsat. We receive you loud and clear.
I'm Hafsat. Are you hearing me?
Yes, yes, we do. Please proceed. Please speak very loudly. Struggling a little bit to hear you.
Hello, are you hearing me?
Yes, we hear you. All right. I don't think it's going to work. Let's go to Professor Becky Tagbo. Professor Becky, warm welcome to you. Which of these 3 networking sessions are you most interested in? Do remind us, introduce yourself and tell us. I know you joined the movement right on the 7th of March, 2022.
Hi, Reda, Charlotte, and everyone. You are right. I joined in March. My name is Becky Tagbo. I'm a professor of pediatrics and vaccinology at the University of Nigeria. I also work at the University of Nigeria Teaching Hospital. I actually work in the area of vaccination at the facility level, community level, as well as district level, national and international. But mostly I am majoring at the facility and community level. So I would really like to join networking too, which is really a passion for me to build confidence in vaccines, and particularly in COVID vaccination. That is the area of my situation analysis as well as action plan and impact accelerator. And I have success stories to tell. Thank you, and over.
All right, wonderful. Thank you, Professor Becky Tagbo. Who shall we hear from next, Charlotte?
I would like to invite Samuel Malogai Badieka.
Greetings, everyone. I'm Samuel Malogai Badieka. I work in Ghana in a regional health directorate. I work as a health research officer. Yeah, the section that I'm interested is in what I'm currently doing.
Oh, I think we just lost Samuel. Let's see if we can get him back.
And
yes.
As to improve confidence in COVID-19 vaccination, we do go on monitoring and supervisory visit to healthcare facilities and then to the field as well to provide support to frontline staff who are providing COVID-19 vaccinations. And then as part of it, there are sometimes we do meet some people that are hesitant and do not want to take the vaccination. In order to also know why they do, we ask them some few questions, and based on that, we are able to convince them to.
All right, Samuel also seems to have a technical difficulty.
For the vaccination.
But we
Yeah, apart
understand
from-
that you're also interested in COVID-19 vaccination. This is likely to be a popular networking theme, but remember, the only way you can access the networking is by going to the Hopin platform. So I've shared again the link, and I showed you how to get the ticket. So hopefully that will be sufficient to get you to where you need to go. I hope there will be, and I see some people have chosen or choosing networking session 1 or 2 or 3 as well. So it's good to see that as well. Now there are 3 plenary sessions. And the tricky part is you'll see some of them are concurrent with a networking session. So you may find yourself in the position where you have to choose, you have to make a choice. So plenary 1 is on building confidence in COVID-19 vaccines. And again, Charlotte explained the difference between the plenary and the networking session. So plenary, everyone is together. We share experience. Networking, you meet, you have one-to-one meetings, and you can really have sort of private conversations on these topics. Plenary 2 will be led by the Women Who Deliver Vaccines Collective, but we'll be hearing from men and women about challenging gender barriers in immunization. And then Plenary 3 will be on female genital schistosomiasis, which affects 56 million women and girls. We have 5 minutes left to hear this time which plenary session are you most interested in, and then we want you to tell us why. And I'd like to invite Mariama Idris. She's a member of the movement. I know she's struggled with connectivity. I'm hoping she will be able to speak. Would love to hear her. I know she's made a lot of effort to get this far in the movement. Mariama, how are you doing?
Hello, everyone. Hello, everyone.
Yes, we hear you loud and clear. Introduce yourself. When did you join the movement, and which plenary session are you most interested in?
Hello, everyone. My name is Mariam Idris from Kano State, Nigeria. I'm happy to meet everyone here today, and I joined this movement in March. I'm so happy to be here to watch today's session. Thank you.
All right. And which of the plenaries are you most interested in? I didn't quite get...
I'm interested in how to build confidence in people on the COVID-19 vaccine.
All right. Okay. Thank you, Mariam. All right. We have we have 4 minutes left. And so I'm going to go check the schedule to make sure we are on track. And I'll show you. So here I go to the reception, then click on schedule. And I can see here that in 4 minutes, we are starting the opening ceremony, celebrating the movement for immunization agenda. Yes.
Thank you very much.
Shumirai Jackson.
Thank you so much.
Go ahead, Mercy. Which plenary session are you most interested in? But do introduce yourself first.
Okay, I'm Mercy Shumirai Jackson. I'm a district health promotion officer from Zimbabwe, Unguza district. I joined the session in March this year, and I'm interested in the plenary 1, which is how to build confidence in COVID-19 vaccination. From the field of my work, which is health promotion, I think this plenary will be very important because it's important to boost confidence in COVID-19 vaccination, to increase the number of vaccinations and reduce the pandemic.
Great. Thank you. Thank you, Mercy. All right. So I think that's it for this session. We have 3 minutes remaining. Just to recap, remember to go to Hopin. And if you are in Hopin, if you've managed to get your ticket and work out the details, please type yes. And if you are not in Hopin, I encourage you, if it really seems impossible to you, stay with us in our Zoom studio if you're here. If you're on YouTube, you can keep watching. At least you'll get the benefits of the plenaries. And yes, so Peter, Sebuabe, Tina, Dr. Martin Mayan, okay, good to see that you're all on Hopin. And so many people hop back and forth between the Zoom plenaries and the networking sessions.